the need for transplant increases over time and has increased over time, and that's like every therapeutic modality. If it's successful, more and more people want to profit from it, and there is so much liver disease around in the population that this will continue to increase for at least the mid, if not long term. There are many more patients waiting for a liver transplant than are livers available, and therefore people die on the waiting list. And research in 3 major areas could address those issues I mentioned before. I can elaborate a little bit on that. One of the big areas would be to be able to take livers we, for safety reasons, currently discard, to bring them to the lab, to hook them up to a machine and pump blood or blood-like solutions through them, and then be able to assess the function. And if they function well, we could still use of the part or a proportion of those livers for a transplant, thereby increasing the number of livers available for transplantation. And in a second step, later on, we may be able to actually modify these organs in a way that we could cure or help organs to function better in a transplant recipient. For example, we could try and prime them so they wouldn't get reinfected again with hepatitis C. A second area which is currently actively pursued in research is to educate the immune system to accept the new liver as the patient's own body instead of suppressing the immune system. And by doing so, we would avoid immunosuppressive drugs and we would avoid their side effects. Both of these areas, this ex vivo perfusion system of livers and tolerance induction, which I sketched as the second area, are currently in early phase clinical trials in liver and in other organs. And finally, the last area, which really is a little futuristic at this point, but I think holds a lot of promise, would be to try and grow livers in a lab, which we could then later on transplant into patients. The tools are there from small animal studies with stem cell technology to seed stem cells into scaffolds prepared from organs or basically printed with 3D printers, and then grow organs in vitro for transplant. Now this is still, sounds very futuristic, but it's still some time away from a clinical application. But I think that the tools are there, and to go there and to help more patients survive their deadly liver disease and profit from a transplant, we need all these types of research, and we need, to do that, we need money. We need your funds. In liver transplant, we profit from work that is done in lung transplant or heart transplant, and hopefully they will profit from what we do in liver transplant. So it's not restricted to liver transplant per se. By supporting this campaign, you can make a difference, not only in Canada, but around the world, in really taking all the opportunity that's around from basic research and translating them into a clinical application to the benefit of patients in need of a transplant.